My name is Claudio Milstein, and I'm the director of the Voice Center at the Head and Neck Institute of the Cleveland Clinic. I met Jeannie many years ago at the Voice Foundation, and I've interacted with her, every year at this meeting, and I got interested in her way of teaching singers and actually a pretty well-defined method of singing. And she invited me to participate in this workshop once she moved to Ohio. So I'm very happy to be part of it now at the Baldwin Wallace University. Well, it's critical because as an educator, you are working and you're modeling the voices of your students. So the job of a singing teacher is to really guide a student to become the best singer they can without injuring their vocal folds or their voices. So a singing teacher needs to be very aware of what are the things that may indicate that a student is in need of expertise other than just their singing technique, but they may need to see a doctor to figure out if they have something else going on. So that's a very important part of the work of a singing educator, is to be aware and to guide a student on voice health. Well, the Voice Center is one of the premier places in the country to get your voice or your throat checked. We see all kind of pathology and all kind of patients with throat problems, but we have a special interest and expertise in working with singers, performers, actors, and anybody that uses their voice in a professional way. Well, we see all kinds of things. A lot of things can happen in the throat. That could be from, misuse, overuse, that can cause irritation all the way to benign vocal fold lesions. You can have malignant lesions like cancer growing from usually smoking, although we are seeing more of an incidence of cancer these days from HPV virus. We have problems in the brain that can cause a malfunction of the throat. We can have problems of aging. We can have just respiratory problems that affect the voice. We can have problems in the GI tract or digestive problems that affect the way we sound. So there's a lot of different things that we see, not just somebody with nodules.